Hi everyone, good morning, namaste, assalamu alaikum. I am Ankit Yadav from Nepal. I am currently studying MBBS in North Bengal Medical College, and today I want to demonstrate femur. Uh, you all know that femur is the longest bone of the body. It is a typical long bone and it is 45 centimeter long. I am going to start it with the anatomical points. This is the femur of the left side. Head is directed medially, slightly forward and upward. Shaft is obliquely downward and anterior surface of the femur is convex. And there are two condyles. So lower surface of the two condyles lies in same horizontal plane. So it was the anatomical point of the femur. Now let's study the parts of the femur. So upper end, shaft and lower end. Upper end consists of the head with fovea, neck and quadrangular area which is called greater trochanter, and there is a lesser trochanter and there is a intertrochanteric line in anteriorly, and posteriorly there is intertrochanteric crest, and in intertrochanteric crest there is a tubercle called quadritubercle. And now I am going to say the parts of the shaft. This one is the shaft of the femur, and you already know that in the upper end and lower end of the long bone, it contains outer compact bone and inner spongy bone, and the spongy bone contains red bone marrow. Okay, so it helps in the biopsy. And in the shaft there is outer compact bone and inner medullary cavity, and you all know that medullary cavity contains yellow bone marrow. This is the feature of the long bone. Now in the shaft there are three borders. This is the lateral border, this is the medial border, and this is the posterior border, which is also called linea aspera. And linea aspera contains medial pectinate line or a spiral line and lateral gluteal line, and they converge to form linea aspera. And in the lower end they divides into lateral supracondylar line and medial supracondylar line. And now I am going to demonstrate the lower end. This part is called the lower end of the femur. Okay, and in the lower end there are 5 surfaces. This is the anterior surface, posterior surface, medial surface, lateral surface, and this is the inferior surface. Okay, and this is also called tibial surface. And there are two condyles. Medially lies medial condyle, and in the lateral part there is lateral condyle, and there is also the medial epicondyle, and this one is the lateral epicondyle. And there is also a fossa laterally. It is called popliteal fossa. And in between these two condyles there is intercondylar fossa. And this posterior surface is also called popliteal surface. Now I am going to say the muscle attachments of the femur, which is very important. So in the head there is a fovea, and in fovea ligamentum teres femoris is attached, and along the margin of the fovea there is synovial membrane. So this was the attachments of the fovea of the head, and femoral artery is the relation of the head, and this one is the neck. So anterior surface of the neck consists of the iliofemoral ligament. And now I am going to say the muscle attachment of this area. This is called the greater trochanter. Okay, this quadrangular area is called the greater trochanter, and there are upper border and 3 surfaces. This one is the anterior surface, this is the lateral surface, and this is the medial surface. In the medial surface there is a trochanteric fossa, and this fossa is called trochanteric fossa. In the upper border piriformis muscle is present, and in the anterior surface there is gluteus minimus, and in the lateral surface there is a oblique line, and in the oblique line there is a gluteus medius muscle, and in this medial surface there is a trochanteric fossa, and in trochanteric fossa obturator externus muscle is present, and above this fossa there is a obturator internus and two gammae, that is superior and inferior gammae. Now there is a lesser trochanter, and there are two muscles there we should remember. In the upper part there is a psoas major muscle, and in the lower part there is a iliacus muscle, and it can be remembered by mnemonics @PI, P for psoas major and I for iliacus. Now I am going to say the muscle attachment of the intertrochanteric crest. There is a quadrate tubercle. So in the quadrate tubercle there is a quadrate femoris muscle. Now there is a muscle attachment in the shaft. In the shaft, in the anterior and lateral surface, 3/4 part is covered by the vastus lateralis muscle, and this intertrochanteric line there is a two muscle, that is in the upper part there is a vastus lateralis muscle which will go like this, and in the lower part there is vastus medialis muscle which will go medial. And I have already told that there is a vastus intermedius muscle in the anterior surface and lateral surface of the shaft in 3/4 part. Now this is linea aspera. So this one medial line is called the pectinate line. So there is pectineus muscle, and this one is the gluteal line, and above this there is a gluteal tuberosity which consists of the gluteus maximus muscle. Now I am going to say the muscle attachment of the linea aspera. So we should start it from medially to laterally. So medially there is a muscle, I have already told that this is vastus medialis muscle, and now there is medial intermuscular septum, then there is adductor muscles. There is a adductor brevis muscle, then there is a adductor longus muscle, then there is a adductor magnus muscle, then there is short head of the biceps femoris, and then there is posterior intermuscular septum, then vastus lateralis, and then vastus intermedius. So this was the muscle attachment of the linea aspera. After that there is a lower end. There are some muscle attachments in the lower end. So first I am going to say this one is the popliteal fossa which lies laterally. So there is popliteus muscle. Okay, it can be remembered easily because popliteal fossa and popliteus muscle, they are linked. Now in the posterior surface of the lower end, medially lies medial head of the gastrocnemius muscle in the lower part of the medial supracondylar line, and in the lower part of the lateral supracondylar line there is lateral head of the gastrocnemius muscle, and there is a plantaris muscle above the lateral head of the gastrocnemius muscle in the lateral supracondylar line in its lower part. Okay, now there is a adductor tubercle in the medial part. This one is the adductor tubercle, and there is a muscle called adductor magnus muscle, and there is articularis genu in the anterior surface. There is articularis genu in the lower end of the anterior surface. There are some joints and articulations in the femur. The head of the femur articulates with the acetabulum of the hip bone, forming hip joint, which is ball and socket type of synovial joint. And there are some movements of the ball and socket type of synovial joint, that is hip joint. Flexion, extension, adduction, abduction, medial rotation, lateral rotation, and circumduction. Now in the lower end, femur articulates with the tibia, So there are two condyles, medial condyle and lateral condyle. So anterior surface of these two condyles articulates with the patella, forming patellofemoral joint, which is saddle type of synovial joint. And then it has two movements, sliding and bleeding movement. In the lower end, it articulates with the tibia, forming knee joint. It is the modified hinge type of synovial joint. And now that's it for today. I am going to end this video.